Lesson 4.1, the bones of the skeletal system. Knowing the meaning of word elements assists you in defining a term. In the term achondroplasia, condition with abnormal early conversion of cartilage into bone leading to dwarfism. The prefix a means without, the root/combining form chondro means cartilage, the suffix plasia means formation. In the word sarcoma, sarcoma, malignant tumor originating in connective tissue, the root sarc means flesh, and the suffix means oma means tumor. Abbreviations are used as term shorthand. Correct abbreviations must be used for terms to avoid errors. BMD, bone mineral density. DEXA, DEXA, dual energy X-ray absorptiometry. FDA, the US, that's the United States, Food and Drug Administration, right? And then IU, international units. There are many ways to realign fractured bone ends to allow for healing. Can you name several methods? The first one is external manipulation. followed by external fixation, such as casts, splints, or traction, and internal fixation, such as wires, plates, rods, screws, and pins. What can occur if a fracture is not realigned? That is going to be loss of function and strength and a deformity. So internal fixation methods may still require the use of external splints or a cast for a period of time. Internal fixation materials are usually removed after the bone fracture has healed. A closed fracture occurs when the bone does not break through the skin. The opposite of that would be an open fracture, and that's when a bone edge breaks through the skin. In a complete fracture, a bone is broken into at least two fragments. In an incomplete fracture, the fracture does not extend across the bone. A pathologic fracture occurs in bone already weakened by a disease such as cancer. A compression fracture occurs from trauma to the vertebrae when compressed or crushed. The root osteo, meaning bone, is common in all four of these terms. All terms deal with the formation or destruction of bone tissue. An osteocyte is a bone cell. An osteoblast is a bone-forming cell. An osteoclast is a bone-removing cell. Osteogenesis is the process of creating new bone tissue. Lesson 4.2, Axial Skeleton. There are 5 regions of the vertebral column: the cervical, thoracic, lumbar, sacral, and coccyx. When you look at figure 4.8, you are able to see the illustrations for the vertebral column. The coccyx is also better known as your tailbone. There are 7 cervical vertebrae. A way to remember this is you have breakfast at 7 a.m. There are 12 thoracic vertebrae. You have lunch at 12 o'clock, noon. There are 5 lumbar vertebrae. You have dinner at 5 o'clock. That is the easiest way to remember how many bones are in each of those 3 sections. The sacrum is actually a fused collection of bone, which we will get into later. The spinal cord is protected within the vertebral column. The function that the intervertebral disc perform is to support and cushion the vertebral column. You can identify different abnormal spinal curvatures, such as scoliosis, which is lateral. Posterior would be kyphosis, and then lordosis, which is convex. Do you know which area of the spinal cord each of these affect? The sacrum, the segment of the vertebral column found that forms part of the pelvis. The spine, which is the vertebral column, and then you have vertebrae, which is plural, which means the bones of the spinal column. Each of the following terms is related to the curvature of the spine. Kyphosis, The normal posterior curve of the spine can be exaggerated in disease, usually the thoracic vertebrae. Lordosis, a normal forward curvature of the lumbar spine that can be exaggerated in disease, is usually the lumbar vertebrae. And scoliosis, an abnormal lateral curve of the spinal column, usually the thoracic region. How many bones make up the human skull? That would be 22. Can you identify on this picture the frontal bone, the parietal bone, the occipital bone, temporal bone, sphenoid bone, and ethmoid bone? What joins the cranium bones together? Those are called sutures. It's kind of why they look like those little zigzag lines there. Those are joints made of thin connective tissue. So what other meanings does suture have? Well, it means to unite by sewing. And it's the material used. These following words are pronounced accordingly. Cranium, Greek for skull. Mandible, Latin for jaw. Maxilla, Latin for jawbone. And zygoma, French for yolk. The word palatine, palate, right? Bone that forms the hard palate and parts of the nose and orbits. Parietal, pariet, means wall. The two bones forming the side walls and roof of the cranium. Sphenoid, sphen means wedge, right? Wedge-shaped bone at the base of the skull. Temporal, temper, T-E-M-P-O-R, side of the head, or your temple, or time. Bone that forms part of the base and sides of the skull. Ethmoid, ethm, E-T-H-M, which means sieve. It's the bone that forms the back of the nose and encloses numerous air cells. So C5 is the fifth cervical vertebrae. C5-6 is the intervertebral space. Remember, intervertebral. So inter means in between, vertebra, and then AL pertaining to. So intervertebral, right? Pertaining to in between the vertebrae. So C5-6 is the intervertebral space between the fifth and the sixth cervical vertebrae. T12 is the 12th thoracic vertebrae. And MRI stands for magnetic resonance imaging, which is a diagnostic technique that produces focused slices of images of structures. And a TMJ, that's a temporomandibular joint. Lesson 4.3. Bones and joints of the shoulder girdle and upper limb. The humerus comes from Latin for shoulder. The clavicle comes from Latin for collarbone. The scapula comes from the Latin for shoulder blade. So where's the shoulder joint? Okay, so it's between the humerus and the scapula, and it's known as a ball and socket joint. So what is a shoulder separation? Well, a separation is a dislocation of the AC joint, right? So that's usually resulting from a fall, okay? What is a shoulder dislocation? So it's when the ball of the humerus comes out of the socket of the scapula. So a shoulder typically dislocates in what position? Well, that's going to be anteriorly, right? So that means anterior being towards the front, so it'd be towards the front side of that joint, not the back, right? So what occurs during subluxation? So a shoulder subluxation is when the ball of the humerus slips partially out of the socket and then moves back in. So when we say articulate, that's articular, that's the joint. We have dislocation, so locat, that's the place, right? Pectoral, that's the pector, so that's going to be the chest. And subluxation, we have luxate, which means dislocate. And those are the roots of those terms. So what causes tennis elbow? Well, that's overuse of the elbow joint. Now, you're students, so keep in mind that another name for tennis elbow is student elbow. So have you ever sat there at your desk or on a table with your elbow on the table, maybe your hand under your chin trying to hold your head up? That's the same thing. Okay, so sometimes people get, of course, tennis elbow or student's elbow by playing sports. So where exactly does the pain occur when you get this? Well, it happens when you straighten or open, right, and closing the fingers. That's when you're really going to feel it. Now, bursitis occurs when fluid accumulation in the bursa due to inflammation or irritation. So you're going to get a fluid pocket that's going to fill up in that bursa right there, in that bursa joint, and it's going to cause swelling and irritation, inflammation, and be very painful. So a bone fracture, of course, those are common injuries to the elbow as well. So activities that could cause this. Can you think of one? Well, sure, falling, or receiving a blow to that area, definitely that'll cause it. So we're going to deconstruct these terms into their elements. So the first one is going to be, right, pronation. So pronat, where it means to bend down, right? ION is an action or a condition. So this would be the action of bending down, right? That would be pronation. So supination, so we have supinat, SUPINAT, and that's to bend backwards, right? So, and then ION, of course, being the action again. So we have the action of bending backwards. Now we have capitulum, so capit /u, right? That combining form means small head, right? And then LUM means small structure, right? So we have a small structure with a small head. Okay, so now we have aspiration, right? So to aspirate, right, ASPIRAT, right, is to breathe on, and then ION, of course, being process again. So this would be the process of breathing, right, is aspiration. Now we have trochlear, so we have trochlee, TROCHLE, which means pulley, and then AR, of course, being pertaining to. So to have trochlear, so that's going to be pertaining to a pulley. So here you're going to use figure 4.14 to identify the bones of the hand and wrist. In your forearm, you have the radius. That's going to go right from your elbow to your thumb. Then you have your ulna, and that goes from your elbow to your little finger or your pinky. And then, of course, now if you go side to side articulation with the wrist joint, there are these small carpal bones. So what exactly is a ganglion cyst? Well, you see that right there. So a ganglion cyst is a fluid-filled cyst that arises from synovial tendon sheaths. Now, I can tell you personally from being a medical assistant is that a lot of people that use their hands a lot, you'll see a ganglion cyst will kind of pop up there on the ulnar side, usually, of the back of the wrist. So if we're standing in anatomical position, right, that would be the posterior part of the wrist. And right there is where we're going to see that ganglion occur. Now, those can be drained as a temporary fix to relieve that pressure. So now we have stenosing tenosynovitis. So this causes pressure to develop under which structure? That's the retina cunin. Okay, so now we have what causes carpal tunnel. You ever had carpal tunnel? Do you know someone who has? Well, that's going to be repetitive movements of the tendon sheaths on the thumb side of the hand, right? That radial side. That's what carpal tunnel is. So if you have a Coles fracture, which wrist bone is broken? That's the radius, right? So in a Coles fracture, the radius is broken. So carpal tunnel syndrome is inflammation of the tendon synovial sheaths on the back of the wrist, right, that's posterior, arising from repetitive movements such as computer keyboard operation, or video games, or cell phone use like texting, or your iPad slash tablet. Yeah, all of those will give you carpal tunnel. Okay, so osteoarthritis is in the hand joints, and now it can be in any joints because it's bone, right? Joint inflammation, osteoarthritis. But in the hand joints, it comes from wear and tear leading to degeneration, which is breakdown of joint cartilage. So small bony spurs called Heberden nodes form over the joint. So now what exactly is rheumatoid arthritis? Now the difference here with osteoarthritis and rheumatoid arthritis is osteo is bilateral, right? So that means it affects both sides of the body equally. Osteoarthritis and both sides. Rheumatoid arthritis is unilateral, meaning it affects one side of the body, not two, normally. Not saying it can't, but most likely it's one side. So it's more common in women, and the onset is between 40 and 60 years of age. Rheumatoid arthritis affects the synovial membrane that lines the joints and tendons. So some lumps, known as rheumatic nodules, form over the small joints of the hand and wrist. So remember, nodule means small knot. So we're going to define the root elements in these. So arthur, right, means joint. Carp is your wrist bones. Osteo is bone. We talked about that. Teno is tendon. And phalange is phalanx. So that could be your finger or your toe. Either one of those are your phalanges. Now, if you'd like to use these 5 root words for some of those 10 flashcards you're making this week, this would be a good option. So let's look at some more of these abbreviations. So we have CTS, carpal tunnel syndrome, OA, osteoarthritis, that's right, RA, rheumatoid arthritis, very good. So PO, that's peroral, which means by mouth. We have PRN, that means when necessary, right? Now we have, so optional kind of related abbreviations to go with this. So we have DJD, right? Degenerative joint disease. We have MCP, meta, right? Carpophalangeal, right? Which means in the hand. I sounded that out for you. The way you spell it is METACARPOPHALANGEAL. Now, this term, MCP, is also, of course, in the back of your book in the appendix there for abbreviations. The next one we're going to have is PIP, and that's proximal interphalangeal. And then THR, total hip replacement. Not to be confused with a TKR, and that's a total knee replacement. 4.4, the pelvic girdle and lower limb. The pelvic girdle has the following functions. 1, it supports the axial skeleton. 2, it transmits the upper body's weight through the lower limbs. 3, it provides attachments for the lower limbs. And 4, it protects the internal reproductive organs, urinary bladder, and distal segment of the large intestine. So now we have the sacroiliac joints, which are two bones, the sacrum and the ilium. The sacroiliac strain, right, is most commonly cause of the lower back pain that some people have. So what's the purpose of the sacroiliac joint? Well, it's to provide shock absorption for the spine. So when we talk about diastasis symphysis pubis, we're talking about stretching the pelvic ligaments during pregnancy, right? Because they have to spread, right? They have to stretch in order for a baby to be born vaginally. So what is the origin of the word, right? Diastasis. So that's Greek for separation, okay? All right, so then we have what is the origin of the word symphysis. Now that is Greek to grow together, right? So some symptoms of diastasis symphysis pubis are pain over the joint, difficulty walking, and trouble climbing stairs, right, and turning over in bed. So now I want to remind you that you must memorize the adjective form of the terms. So it's not easy or as easy as simply adding an ly or an al to the end of a root. It doesn't work that way. So for an example, so the adjective form of femur is femoral, right? And that refers to the thigh bone. The adjective form of pelvis is pelvic, right? Now that term refers to the basin-shaped cavity at the base of the spine. And we have the adjective form of pubis, which is pubic, right, which refers to the pubic bone. So now we're going to be talking about more of the adjectives. So the adjective form of ischium is ischial, right? So this term refers to the area pertaining to the lower and posterior part of the hip bone. Also note the plural form becomes ischia, right? The plural form. So we've gone from ischium to ischial to ischia. All right, so because there's more than one. So the adjective form of sacrum is sacral, right? And that refers to the area pertaining to the sacrum or pelvis. All right. Any questions? If you have one, please write it down so that you can ask me at the beginning of our lecture this Tuesday coming up. So, what sport is the main cause of a hip pointer injury? Well, that's going to be football. Football with a blow to the rim of the pelvis, causing bruising of bone and the surrounding tissues. So what disorder is caused by aging and normal wear and tear of the joint? If you're thinking osteoarthritis, you would be correct. Now, so let's talk about the disorder that's often first seen in the hands, but it can progress to the hips. That's the rheumatoid arthritis. Very good. So now what's necrosis? So necrosis is tissue death, right? OSIS is abnormal condition, right? And then in this case we have our root word as well. So now let's look at avascular necrosis. So that's the head of the femur, right? Which needs blood, right? Because your bone is alive and it needs blood to function. So the head of the femur occurs when the blood supply is cut off, right? And that's usually a result of trauma. Now, I can tell you I've had patients in the past that have had bilateral avascular necrosis, and it's for when they've been jumping on and off of trailers and different equipment over the years, and that just just stress all the time, right there where the ball of the femur goes into the hip socket, it can cause this avascular necrosis. So what population are more at risk for femoral fractures? That's going to be elderly females. Because remember, like I said, you're talking about osteoporosis, and it's more common in women, but not only women, but more common. And it usually happens, what? After menopause, right? So when women have a tendency to get older, as in elderly, it is possible for them to have a femoral fracture, right? So now when we talk about this, so there's hormones, there's calcium depletion, and all of this after menopause, which work to make bones brittle and then make them subject to fracture and a fall. All right, so the knee. So your knee is a hinged joint, right? And it has 4 bones. So we have the lower end of the femur, which is kind of shaped like a horseshoe, right? We have the flat upper end of the tibia. We have a flat triangular bone known as your patella, right? Or your kneecap. Yes, it's shaped like a triangle. Let's see. And it's not exactly even-sided either. And then of course that's embedded into the patellar tendon, which articulates with the femur, and then the fibula, right, which forms a separate joint by articulating with the tibia, right, and this is called the tibiofibular joint. All right, so again, it's not only important to be able to spell the word, but it's also important to say the word. So look at these words right here and make sure that you know them in the correct order as well, right? The correct anatomical order. So we have, if you look at these words, the first one, if we're going to start up here at the pelvis, is your pubis, right? And then after that, that long bone, right? That people like to call their thigh, that's your femur. Okay, below that is your patella, right? That's your kneecap. Under that is your tough tibia, right? That's the larger bone. And then we have your fine fibula, and that's going to be the smaller bone that runs more lateral there. So you have your tibia and you have your fibula. So the plural form of meniscus is menisci. So meniscus comes from the Greek word for crescent, right? So it's a disc of cartilage between bones of a joint. In this case, the knee joint, the plural form, menisci. Patella, right? The plural form, patelli. Okay, patella comes from the Latin for small plate. It's a thin circular bone in front of the knee joint, embedded in the patellar tendon. The plural form is patelli. So let's look at this. Symphysis comes from Greek for growing together. Symphysis is the term used for either of the 2 pubic bones. Both bones are the symphyses. So that's just another plural to add to your vocabulary. Why is arthrocentesis performed? Well, that's to examine the fluid from an infected or diseased knee. So what's the difference between a diagnostic and a surgical arthroscopy? Well, a diagnostic arthroscopy is the visual examination only of the internal knee joint. A surgical arthroscopy involves the visualization and correction of any deformities found. So in an autograft, the tissue graft is taken from the patient and placed on another area of the body on the same patient. Auto means self. So in a total knee replacement, what exactly are they replacing? Well, as you can see here, right, the end of the femur, right, so that area there where the condyles are, that area gets replaced, as well as the very top of the tibia, right, and the back of the patella. Okay, all of those get replaced, right, in a total replacement, and that is called a prosthesis. So the common root for these terms is arthur, which means joint, right? A-R-T-H-R. So an arthrocentesis means the withdrawal of fluid from a joint, because the suffix centesis is to puncture, right? In a arthrodesis, desis means to fuse together. In arthrography, graphy is the process of recording, right? So I don't want you to get confused between a graph and a gram, right? So a graph is the process of recording. A gram is a picture. Think Instagram. There you go. That'll help you. Okay, so in arthroplasty, the plasty means reshaping by surgery. Okay, and then we have an arthroscopy, which is the visual examination of the interior of a joint using an endoscope. The suffix scopy, right, S-C-O-P-Y, means the process of using an instrument to examine visually. So in healthcare, the specialty that's concerned with the foot is podiatry, and podiatrists cannot work above the ankle. A bunion, right, is on the big toe, and it's termed a hallux valgus because hallux is your big toe. Okay. So what's more susceptible to strains and sprains? That's going to be the ankle. Absolutely. And in a pot fracture, P-O-T-T, like you see in number 3 there, pot fracture is where the fracture line is on the fibula near the ankle. It can also be associated with a fracture of the medial malleolus of the tibia. So now we're going to go with the common name for the following medical terms. So the heel, that's the calcaneus, right? All right, so then we have the heel bone, and that's the talus. Okay, and then we have the tarsus. Now that's going to be 7 bones of the foot that form the ankle and the instep, right, your arch of your foot. Okay, we have the metatarsi, right, so those are the parallel foot bones that connect the tarsus to the phalanges. Phalanges, of course, being your toes. Now, phalanges also refer to the fingers, but since we're talking about podiatry at this point, these would be your toes. All right, so how many phalanges are there in each toe? I'm going to look that up. Yeah, you're going to need to know that for A&P. And so what's the singular of phalanges? Well, that would be your phalanx. Lesson 4.5, the diagnostic and therapeutic procedures for bone disorders. So bone mineral density, BMD, right? So that's the screening used to diagnose, right, and follow osteoporosis. All right, so now we have a nuclear bone scan. So that uses radioactive substances injected into the bloodstream and a specialized camera to show bone infection, fractures, arthritis, and bone cancers. So now we have blood tests, right? So those are used to examine levels of serum calcium, right? Serum alkaline phosphate and serum phosphate, which can be abnormal in metabolic bone disorders. And then we have a bone biopsy, right? Remember biopsy, so to view life. So in a bone biopsy, it's used to diagnose osteomalacia. So various imaging techniques can be used to diagnose bone cancer. So first we're going to start with an x-ray. So an x-ray shows the location, shape, and size of a bone tumor. Computed tomography, otherwise known as a CAT or CT scan, provides a series of detailed images of part of the body using x-rays linked together, right, to a computer, right? So the x-rays are linked to a computer, thus computed tomography. Okay, so now we have magnetic resonance imaging, MRIs. So these provide a series of detailed images of parts of the body using a magnet linked to the computer. And then we have a PET scan, which is a positron emission tomography. That it's a scan that uses radioactive glucose that's injected into the bloodstream, right? So that's sugar, glucose, right? That's injected into the bloodstream, and a scanner to see where glucose is used at the body. Cancerous cells use more glucose than normal cells. There you go. So surgery is the most common treatment for many bone disorders. Chemotherapy uses anti-cancer drugs to kill cells. Radiotherapy uses high-energy X-rays to kill cancer cells and is often used in conjunction with surgery. Cryosurgery uses liquid nitrogen to freeze and kill cancer cells. And then drug therapy is specific for types of metabolic bone disorders. So lastly we have here is amputation, right? So the root word amput, A-M-P-U-T, means to prune, right? So, or top off, and the suffix ation means process, right? So then we have a biopsy, and we talked about that, right? To view life. We have chemotherapy, a root/combining form of chemo, CHEM/O, means chemical, and the suffix therapy means medical treatment. Then lastly, we have radiotherapy, which is the root word/combining form of RADI/O, which means X-ray or radiation, and then the suffix therapy, which means medical treatment.